So these days the age is just a number. So everybody wants to look beautiful for the face. They don't want to age. So the answer is the facelift surgery. So if your face looks like this, so there are signs of the aging. The lower face is hanging down. There is a looseness of the neck. Everybody is going to age. So due to gravity, the skin becomes loose and there is redundant skin in the lower face. So the answer is the facelift surgery. It is always done by the plastic surgeons all over the world to address for the jawline contouring and the tighter neck and the face. So you can watch this video till the end. So all your queries for the facelift surgery will be answered in this video. So we keep on posting such videos on the YouTube regularly. So you can subscribe our channel. So it will be a great help. And you can hit the bell button so you get the notification for any new video. Facelift surgery is a cosmetic surgical procedure which is designed to improve the signs of aging, especially on the lower face and the neck. So it involves the tightening of the skin and the underlying muscles and the tissues to give you a more youthful appearance. So what are the goals of the facelift surgery? So first is the sagging skin. So there is a lot of sagging with age on the lower face and the neck. So we can lift and tighten the loose or the sagging facial skin. Second is the deep facial wrinkles, especially the nasolabial folds. So there is a crease running from the nose to the mouth, so that can be improved. And the jowls. So jowls is the accumulation of the sagging skin over the jawline, so it can remove or reduce the sagging skin along with the jawline contouring. So neck aging. So it can address the loose skin or the bending in the neck area. And last is the volume loss. So fat grafting can be done along with the facelift surgery, so we can give you a good volume, especially in the cheeks area. So how does it work? So during the surgery, a surgeon typically makes an incision which is almost hidden. It is in front of the ear, then back of the ear, going to the hairline. So this is the incision, so nothing is visible on the face. Then the underlying tissues are dissected, the muscles are repositioned, the mask layer is lifted with the permanent sutures. So you get a lifted underlying tissues. And last is the excess of the skin, which is after the deeper layers are tightened, we remove the excess skin. The remaining skin is redraped for a smoother appearance. And the fat can be sculpted, removed or redistributed for the balance. So what are the types of the facelifts? So facelifts are tailored to the individual needs, and there are various techniques which can suit the different levels of the aging and to get the desired outcome. So what is a traditional facelift? So it involves the incision around the temples, then in front and behind the ear and the hairline. This is the extended facelift. It addresses the significant sagging in the mid face, the lower face, the jowls and the neck area. So it is often combined with the neck lift for a comprehensive result. Then the second is the mini facelift. So in mini facelift, the cut is smaller. It is not extended beyond the ear, and it is often limited for a lesser degree of the sagging of the skin. So we are giving a small cut just around the ear. So it is suitable for younger patients which have the early signs of aging. Recovery is quicker and the results are more subtle. Then the third is the SMAS facelift. So there is a SMAS layer which is a fibrous tissue and the muscle, so we can tighten the deeper facial layers for the long standing and the natural results. So it addresses both the skin and the underlying muscles. And last is the deep plane facelift. So it focuses on lifting the deeper structures without overlying stretching of the skin. So it is ideal for individuals which are in advanced aging, and it offers a dramatic results. Only a plastic surgeon should be trained for the deep plane facelift. So what is the recovery process? So immediately after the surgery, there will be a bandage which will to minimize the swelling and support the skin for just few days, maybe 2 to 4 days. So there is a very small tube which is a drain, a small drain to remove the excess fluid if it is built up under the skin. Then the pain or the swelling or the bruising, these are very common, but it can be easily manageable with the prescribed medications for just 1 week. So for the timeline, the first 1 to 2 weeks, there can be swelling, bruising, which is at the peak, and then it begins to subside. Then in 2 to 4 weeks, most people return to work and the light activities, and the best result or the final outcome is at 3 months. So you can see the visible tissues, they settle down, and the scars, they fade away. So what is the post-operative care? So you have to keep your head elevated to reduce the swelling while sleeping, and you should avoid strenuous activities or heavy lifting for 1 month. And you should follow all the wound care instructions and the follow-up visits to the clinic to minimize the infection and the scar. So what are the different procedures which are combined with your facelift surgery? To enhance the results, the facelift is often paired with the other cosmetic procedures such as the eyelift surgery. So eyelid surgery is called blepharoplasty. It can address the drooping eyelids or the under eye bags. And second is the brow lift. It can correct the forehead wrinkles and the drooping eyebrows. Then the fat grafting to the face. So I am very much into the fat grafting, so it gives you a natural youthful appearance. We can give you a denser fat, we can give you a liquid fat called the nano fat along with the fat grafting procedures. And lastly, for the skin only, we can do deep chemical peels or the laser resurfacing with the fractional CO2 laser. It improves the skin texture and the tone. So usually the treatment of the skin with the laser and the fat grafting and the facelift, these three are done together. So you can opt for the eyelid surgery or for the brow lift. So what are the risks and the complications? So while generally it is safe, but facelift surgery carries some risk. So first is the hematoma. So that is a collection of the blood under the skin which might require the drainage. If you are hypertensive or you have been on blood thinning medications, the chances of hematoma increases. Second is the infection. It is rare, but it can be treated with the antibiotics and the proper care. The nerve injury. So there can be a temporary numbness with the facial weakness of the muscles. It can be temporary and it improves. The permanent nerve injury is very rare if your plastic surgeon is trained and doing a lot of facelift surgeries. Then the scarring. So there is an incision which is hidden, but the scars may still form. So you need proper care in the post-operative time, especially we prescribe the silicone gels which reduce the scar. And last is the poor wound healing. So normally the wound, it heals in 2 to 3 weeks, but there can be poor wound healing, especially if you are a smoker and you have certain medical conditions. So what is the longevity of the result? A facelift can provide long-lasting result, often for 10 to 15 years. The aging will continue, but maintaining a healthy lifestyle, example the skin care, the sun protection, can prolong the benefits. So you want more information or you want to find a plastic surgeon who is trained in the facelift surgery, you can send us your pictures or you can visit us for a consultation. So we'll advise you sincerely what type of facelift, whether the mini facelift, the extended facelift or the deep plane facelift, and what are the other procedures which can be done. So we also do many non-surgical facelifts. The results are subtle. We have to choose our client wisely. Thank you.